So my name is Patricia Tennen, and I'm with Kentucky Youth Advocates. Thank you all for joining us today. We're really excited to have you. We've got a great forum planned. Just a reminder, we are going to be recording today's forum to share later as both a video and a podcast. So we ask that you please stay muted. But if you've got questions or comments, feel free to use the chat feature. Panelists, you can respond in your comments if you want, or we'll also be collecting those to communicate with you after the fact. So with that, I am going to turn it over to Terry Brooks.
Hey, Patricia, thanks, and welcome to everyone. I think we start each of these by saying whether you are 27 for 27, because this is our 27th forum, or whether this is your very first one. We're really happy to have you here today. I do want to remind you that many of you have participated this fall. As you know, KYA has done a series of electoral forums around races for the state Senate and state House. We're now moving upstream a little bit, and I'm sure this information is on our website, and maybe we can link it, Patricia or Kelsey, during the forum. Tomorrow we will be doing a forum with U.S. Senate candidate Amy McGrath, and again, the focus on that is going to be health and human services, kid and family issues. So we certainly would encourage you to join for that conversation. And we're delighted today to have a really important discussion. I'm personally delighted because of the two groups that are joining us. So I'm going to take just 30 seconds and do a little riff because of the deep respect I have for them. You know, in Kentucky, frankly, I think all of us in the nonprofit sector tend to realize that one of the challenges we have is a very conservative philanthropic framework. Candidly, foundations don't want to lay themselves out. They're much more comfortable building a fountain or funding a building than tackling issues. A big exception to that is the Foundation for Healthy Kentucky. Under the leadership of one of the guests joining us today and its CEO, Ben Chandler, the foundation has looked at, you know, absolutely one of the toughest health issues to tackle, tobacco, and they have really been front and center in waging a battle for Kentucky's kids on that front. So the Foundation for Healthy Kentucky stands pretty uniquely, perhaps along with Kosar Charities, as two groups that are very unconventional within the Kentucky philanthropic landscape. The other group that is joining us today is the American Heart Association. And what I love about the American Heart Association is they approach their mission kind of like KYA does, because you've heard us talk about that we're not smart enough to figure how kids grow up in silos. The American Heart Association defines its mission in a similarly integrated way. So whether it is complete streets or health standards for early childhood, child care centers, physical activity for kids in school, or tobacco issues, the American Heart Association exerts its influence. And so we really appreciate that intersector, interdisciplinary frame that they bring to it. But to specifically introduce the Foundation and American Heart Association reps, no pressure on you guys since I've built you up, but we have our KYA's lead policy person and specialist in all matters concerning health, Mahak Kalra. So Mahak, I think the rest of this forum is yours. Again, thanks for joining today. We really, really, really hope to see you on tomorrow's forum with candidate McGrath. We have extended a parallel invitation to Leader McConnell. And so we're hoping that you're going to hear us invite you to a conversation with Senator McConnell as well. Mahak?
Thanks, Terry. And thank you all for joining today's forum. And so today's forum, we're really going to talk about curbing tobacco use among youth. And we've made such great progress in the last few years. So we're going to start off with a presentation by Bonnie Hackbarth, who's the Vice President of External Affairs at the Foundation for a Healthy Kentucky. And then we're going to have a youth that's joining us, which I'm sure he's very excited to get off of NTI for a few hours and join us just to talk about his experience as a youth advocate and really taking this issue front and center, whether it's advocating at the state level or advocating in his local community. And then we are going to have a panel discussion with not only Ben and also Bonnie, but we're also going to have Shannon Smith from the Heart Association, who's the Kentucky Government Relations Director at the Heart Association. So with that being said, I'm going to turn it over to Bonnie to kind of give us an overview.
Good morning, everyone. It's great to see all of your faces. Ben, I'm looking forward to talking with you and hearing what you've been up to lately. We're so grateful for the advocacy of youth, which has made a big difference in helping this whole coalition of organizations have some pretty good successes over the last few years. Started in 2018 when we advocated for a cigarette tax. We were able to get the largest tax increase on cigarettes in the history of Kentucky at 50 cents per pack. Now, it's not what we wanted. We wanted $1, but we also know that sometimes you have to make compromises. But in the first 12 months after that tax went into effect, we saw a decrease of 39 million packs of cigarettes purchased in the Commonwealth. That was a 10.1% drop from the year before, compared to nationally a 6% drop. And in the few years leading up to the year that the tax went into effect in Kentucky, we'd been seeing about 3.5% drops annually. So we think that that cigarette tax had a major impact on reducing tobacco purchases and use in Kentucky. The next year, 2019, we focused really on youth with the Tobacco-Free Schools bill. Before that bill was introduced, 42% of Kentucky school districts had voluntarily adopted tobacco-free campus policies, with the idea that when you change the culture and tobacco use is not the norm, that kids start to not see it as a positive thing to do. And when it's not reinforced by teachers and other adults that they respect, they're less likely to use tobacco. And then also, of course, you reduce the exposure to secondhand smoke and emissions at things like football games and other campus activities. So tobacco-free schools is a really important measure. And once we were able to get that law passed, the percentage went from 42% of Kentucky school districts to 97%. Now, there are still 5 school districts in Kentucky that have not yet adopted tobacco-free policies, and you might ask how that can be given that we have a law. Well, another compromise had to happen in order to get that law passed, and the compromise was an opt-out provision. So for 3 years, we're 1 year down, the school districts have an ability to opt out. Now, we know that some of the school districts are working on this. Union County tells me that they're working on getting a policy through, and we're hoping that the other 4 counties down in way southeastern Kentucky are going to be working on it as well. And you can go to our website, tobaccofreestudents.org, to see the map, all one word, tobaccofreestudents.org, of school districts that have yet to go tobacco-free. And really, if you're in there, encourage those school districts to do that for the protection of their youth. It also reduces adult tobacco use, which is wonderful. This past year, we had 2 items that we were really focusing on. The first was Tobacco 21. The foundation started at the federal level by working with Senator Mitch McConnell to get that passed at the federal level, and that happened in December of 2019. And then we began working at the state level You might ask why we need a state law when we already have a federal law that prohibits the sale of tobacco products to anyone under 21. And part of the reason was that in Kentucky, we had what were called PUP laws, purchase, use, and possession laws that penalized youth for purchasing, using, or possessing tobacco. And we needed to repeal those because what the research shows is that punishing youth by getting them into the judicial system actually ends up causing worse health outcomes over the long term. And so the Tobacco 21 law in Kentucky not only raised the legal age from 18 to 21, it also eliminated those PUP laws and put the onus on the retailers to check ID. So that was really important. Our second measure was a tax, an excise tax on e-cigarettes. Until this year, they were the only tobacco products sold in Kentucky that weren't subject to any kind of excise tax. And so we were seeking a tax that was equivalent to the tax on cigarettes. In one sense, we got a higher tax, and in one sense, we got a lower tax. So here's what happened. The legislature decided to tax e-cigarettes that, like the Juul and other pod-based e-cigarettes, at $1.50 per pod. And then for open systems, like the liquids that you can buy in vaping stores, at 15% per milliliter. And so what's going to happen is those e-cigarettes that tend to be most popular with youth prior to this year are taxed at a much higher rate than the open systems that tend to be more popular with adults. It's not exactly what we wanted, and we'll be measuring the effect of that, but the foundation considered that a win. And our hope is that given the big loophole that the FDA created when it did only a partial ban of flavored e-cigarettes, this $1.50 per pod tax will be a deterrent to youth for using e-cigarettes. So that's what we've been able to achieve so far with the support of groups and organizations like you and with the American Heart Association. We're taking on a new battle this coming year, and that's what this webinar is about, and we'll talk about that in just a couple of minutes. So back to you, Mahak.
Thanks, Bonnie. That's a great overview. Ben, would you like to share your experience as a youth advocating for state level policy change?
Yeah, sure. Hi, everyone. My name is Ben Robinson, and I wanted to give you a quick rundown of what it's like being a high school youth advocating for statewide tobacco policy change. My first experience was a training seminar with KOA, where I not only met peers with the same drive to make change such as myself, but I also participated in a focus group about youth insight on tobacco use. Meeting people who wanted to make change was an invigorating experience, as I realized I wasn't really alone. Other people like me saw the problem and wanted to do something about it. We spent the day providing valuable insight on how youth view tobacco and what we like and don't like about the movement centered around making a change. One of the changes that we absolutely loved took place in the form of participating in Children's Advocacy Day at the Capitol. I attended my very first Children's Advocacy Day this past January with peers, and I helped to lobby for change like Senate Bill 56, which raised the legal age to purchase, use, or possess tobacco from 18 to 21 years old. While a change in 3 years may not seem like a drastic difference on the surface, it effectively disrupted the ease of access of which high schoolers could get these tobacco products. While plenty of high schoolers have friends who are 18 or 18 themselves, it's much less common for them to know someone who's 21. By standing in the state capitol and petitioning for change, I gained a new sense of responsibility for my role in public policy change, especially for those who can't vote for their voice, the youth. Change doesn't always have to be made through attending rallies or going to the state capitol in Frankfurt, though. Another initiative I took was creating a video with my friends to help educate my peers about the dangers and misconceptions surrounding tobacco products. This video was a grassroots effort to let teenagers know all about the lies they've been sold from big tobacco companies. Teenagers are tired of hearing adults tell them what's best for them, yet it's important that the message still be spread about how truly harmful these tobacco products are. The message suddenly becomes a lot clearer when it's your classmate telling you about the toxic chemicals found in the tobacco products, as opposed to your mom or dad. Well, that was a quick summary of some of the things I've done, and thank you for listening.
Thanks, Ben. And I know you've been working hard advocating for not only your needs, but also your peers across the state and in your community. So I appreciate all the work that you've done. And I look forward to continuously working with you this upcoming year, this legislative session. So we're now going to turn it over to our panelists. And so Shannon Smith is now going to be joining us in this conversation. And so I'm going to start by asking, since we have such a diverse set of partners on the call that represent various sectors, whether it's early childhood, juvenile justice, child welfare, health, and others, can you give me a rundown, Bonnie, if you don't mind, of sharing what is the tobacco policy that you are working to advocate for this legislative session?
So we believe this tobacco policy we're going to be working on is the next logical step after all of the things that we've been able to achieve over the last 3 years. And what we're working to do is give local communities a tool in their toolbox that they can use to reduce tobacco use and all of the healthcare costs associated with it in their local communities. Right now, local communities are not allowed in Kentucky. They're prohibited or preempted by state law from adopting all kinds of policies that are known to be effective in reducing tobacco use. So for example, if a city wants to say tobacco retailers can't locate within 100 feet of a school or a playground, they're not allowed to do that right now. If they would like to say, well, if you're located near a school or playground, you can't advertise tobacco products in the window of your convenience store. Again, they can't do that. And that's because there's a law on the books in Kentucky that passed 24 years ago at the behest of the big tobacco companies, which were on a nationwide campaign to preempt local tobacco laws and overturn several community laws that were already on the books. So there's a preemption law on Kentucky's books that says you can't pass anything that controls the distribution, marketing, sale, or use of tobacco products in Kentucky at the local level. That has to happen at the state level. The only thing that local jurisdictions can do are the smoke-free laws that now cover about 36% of our population. Anything else is prohibited. And what we would like to do is repeal that law and give communities local control to be able to reduce the costs and use of tobacco in their communities.
Thank you, Bonnie. Shannon, is there anything that you want to add?
Bonnie does a great job describing what we are doing. And a couple of the reasons I'll just add, Kentucky ranks first in the national cancer deaths, second for chronic obstructive pulmonary disease, and ninth in heart disease. These are, we know, caused by mostly caused by the use of tobacco. And just like Bonnie said, this is a way to combat health disparities in local communities. And some communities have a much higher rate of tobacco use than other communities. And just to reiterate the idea, this does not force a community to pass a law. It just allows them the ability, and from the American Heart Association's perspective, and just that great introduction that Terry gave us, it is about longer, healthier lives for everyone, and especially our children. And then one other point that I will add is the cost of smoking per family in Kentucky is over $1,000. That's a lot of money annually to be going out of our pockets to combat this disease. So I'll stop there.
That cost is the extra taxes that every single household in Kentucky pays to cover the health care for people who smoke, for smoking related disease. So that's a big cost. In addition, it costs our economy $1.92 billion a year, 586 million of which is Medicaid. Medicaid covers those healthcare costs, and it costs businesses in lost productivity nearly $2.8 billion a year. in lost productivity for people who use tobacco based on illnesses, time away from the desk for smoke breaks, extra cleaning, extra liability insurance, and of course, extra health insurance coverage.
Thank you for sharing that information. So I know we just talked, so let's go ahead and think about the future. If the foundation, the Heart Association, KYA, and other health advocates are successful in advocating for this policy, what are some examples? Ben, can you share some on, as a youth, what do you think could happen in your local community or other communities across the state?
Yeah, I've got a few examples of what a community could do. One would be implementing warnings on retail tobacco displays that warn about the dangers of using tobacco products. Much like how the FDA already does this on cigarette packages and advertisements. Actually, I was doing a little bit of research. As of this year in March, the FDA released new health warnings that are legally required to appear on the top 50% of the front and rear panels of cigarette packages, with at least another 20% at the top of all advertisements. By putting the health warnings and visuals directly on the packages, this allows the consumer to know right away what they're getting into with their purchase of the tobacco product. Local communities could focus on passing further legislation that mandates a set number of infographics or FDA-sanctioned visuals around areas where tobacco products are sold. Besides passing legislation that requires certain health warnings, a community could target where exactly tobacco products are allowed to be advertised. Much like how Bonnie was saying previously, we don't want kids playing on playgrounds and looking across the street and seeing a big old sign advertising tobacco products. Should there really be a bright and shiny tobacco product advertisement right across the street from the local middle school and high school? By passing legislation to set a minimum distance between advertisements and schools, you can help ensure that less youth fall prey to big marketing strategies. Better yet, a community could analyze where exactly these tobacco products are being sold. Back to what Bonnie said, say you have a gas station right across the street from the local high school or middle school, that allows quick and relatively easy access to hop across the street during a break and come back with all sorts of tobacco products. What a community could do is set laws pertaining to a minimum distance from schools or community centers that tobacco products can be purchased. By increasing the distance between our vulnerable populations and tobacco products, you're helping to save lives and eliminate future use.
Thanks, Ben.
Good.
Bonnie or Shannon, do you want to chime in on other examples that local communities could use this tool for?
One thing they could do is they might want to license retail tobacco outlets in their community. Right now, you can't license a retail outlet, so we don't really know who all is selling tobacco products. And it'd be really nice to have an idea of where tobacco products are being sold across a community. In doing that, they also might say only a certain number of stores can be located in a given area per square mile or whatever, so that we don't just have a huge gathering of tobacco stores, say, in an African-American community, which is really often the case. You see a clustering of retailers located and advertising products that are particularly attractive to certain populations in their communities. And if we could reduce that, I think these advertising restrictions that Ben talks about are really important, because guess what? Advertising works. And the companies spend billions and billions of dollars on advertising every year. When I worked at the FTC, we put out a report every year on how much money tobacco companies spent marketing their products. And it's mind-boggling, the amount, and it's because it works. And so if we can reduce the advertising that our youth see especially, then that can really help reduce our youth tobacco use rate. And remember, 90% of tobacco use starts in youth. We're seeing a study that just came out yesterday showing it's shifting older a little bit into the young adults, 21, 22. But if we can restrict, particularly at the high school and middle school level, that would have a big effect on reducing our long-term tobacco use rates. Shannon?
So these are great examples of what we can do. And I would like to bring up what this isn't going to allow, because I think it's an important point to make, and that when we're talking about the things that this allows us to do, it does not allow us or give us the authority or communities the authority to pass a cigarette tax. So just want to make sure that everyone understands that this is not a tax on products. It would not open the door for communities to increase that. And while you can provide or require a license for these retail outlets that sell the product, it is not a tax on the product itself. So those are all great examples. I just wanted to make that one clarifying point.
I think that's important, Shannon. So a community could have a fee associated with a license that retailer pays, but she's right, no tax. That's prohibited by our Constitution, a case that it was interpreted that under the Constitution that you cannot at the local community level add a tax, an excise tax to tobacco products.
Thank you for that. And I'm so glad that you brought up what it can't do, because often we talk about examples that could forward the policy and we could actually implement the policy. So it's helpful to hear that. So I wanted to touch on equity, because we have a renewed focus in our work, especially when it comes to policy. How does this policy really advance race equity? Bonnie, if you want to kick it off, and Shannon, please chime in as well.
Yes, thanks for asking that question. Reducing health disparities is core to the mission of the Foundation for a Healthy Kentucky, and it's one of the reasons that we're involved in this issue area, because the smoking rates tend to be very high among people who are low incomes, people who are members of the LGBTQ community. The African American community has a very high rate of using menthol tobacco products, and that's because they're marketed directly to them. That is what is marketed to the African American community. And it's known that menthol cigarettes are often harder to quit than non-flavored cigarettes. And so you have people who are addicted for longer periods of time and suffer the health issues associated with that. So anything that we can do to reduce tobacco use is generally going to benefit that lower income minority community more than the higher income, typically the white community. Now, the exception to that is youth. Because of e-cigarettes, we used to have this major declining scale for youth use of tobacco products because smoking was going down at such a rapid rate, and it continues to go down for youth. But as of 2018, we now have major increases in youth use of tobacco because of e-cigarettes. So for our youth population, we're particularly focused on those products and seeing how we can help kids understand that these are tobacco products and that they're highly addictive, and that by using them, they're setting themselves up for a lifetime of addiction.
Yep, and I will just add to that in that the display, the marketing that big tobacco tends to do in communities of lower income is disproportionately higher than communities that have a higher level of income. So this would really target that marketing perspective to touch equity in the idea of giving communities those tools to address equity.
Yeah.
Thank you for that.
Another population that has a very high tobacco use is people who are suffering with mental health disorders. And again, and substance use disorders. And if we can help them overcome a tobacco addiction, what the research shows is, we used to think that, well, cigarettes were the lesser evil, tobacco was the lesser evil of drugs. But what we found in the research is that helping people to overcome the nicotine addiction as well as other substance addictions is more beneficial long-term and helps them. And it's better to do them both together. So that's more effective. So these populations that are dealing with some particular issues are often also dealing with tobacco.
Mm-hmm. Thanks for
Can I just add something? Can I just add something to that?
Vivian,
this is Vivian with the Office of Health Equity, the State Department for Public Health. And one thing that I was reminded of by my folks in behavioral health is that our physically and intellectually challenged folks are another high-risk population that smoke. So they've often told me that a lot of the messaging of tobacco cessation and and tobacco awareness, they're a group that's often left out. And they've pointed that out to me several times, and I have the data to show that they do have an increased risk for heart disease, hypertension, smoking, and some of those other things that our majority populations have, but they're just not talked about. So I just wanted to mention them as well to make sure that we don't forget about them.
Vivian, that's a really important point, and it speaks to the messages that the tobacco industry has used throughout its history. And you can see those same themes in a modern format today that you saw in the 1950s, and they are fit in, be cool, stay thin, smoke
Exactly.
and eat, and that this is, safer than whatever. I mean, back in the 1950s, they had physicians in tobacco ads. Well, today, this e-cigarette ads talk about how much safer they are than cigarettes, which is at issue. We're really not sure. Yes, there are fewer chemicals in the e-cigarette aerosol. It's not vapor, by the way, it's aerosol, but there are different chemicals because of the heating up of the metal. So there are small microparticles of metal that can go into your lungs. So there are different things about e-cigarettes. So the jury's still out on the difference in safety, but it's very, very clear that e-cigarettes are not safe for youth, and they are not a safe product in general. It's a nicotine product that you're becoming addicted to, and it's putting into your lungs things that your lungs just were not meant to process. But this marketing of being cool is the same kind of marketing that they've been using for years, and it appeals to these vulnerable populations.
Thanks, Bonnie, and thanks, Vivian, for jumping in. It's important to note how those special populations are really targeted by the marketing and what the tactics are too. So I'm so glad that you had jumped in and kind of shared those perspectives. I kind of want to jump ahead because something that's sticking out to me is this policy has been in the books for 24 years now. So why are we repealing it? What has happened to cause us to think about repealing?
Shannon, you want me to go ahead? Okay. So it's the next logical step. What we've had is 24 years of local communities not being able to use these important tools. And we've done several things at the state level in Kentucky of late. And now we really need to give these local communities a tool because smoking rates are different. In fact, on Monday, Interact for Health, which is a health foundation that works in Northern Kentucky and Greater Cincinnati, released a report that showed that smoking rates are higher in Northern Kentucky than in many areas of the state, and that in the rural Northern Kentucky counties, smoking rates are as high as 32%. And that's for traditional cigarette smoking, 32%. So 1 in 3 people. That's an extremely high rate compared to a national rate down at about 15, 14%. So double, more than double. So we need to be able to address these disparities at the local level and focus on the issues that are particularly affecting those communities.
Yes, and I would like to add in, Kentucky, we tried to do smoke-free before, statewide smoke-free. And it's incredibly difficult pill to swallow for some rural Kentucky counties on having the state come in and say what they can and can't do. They don't like that. They didn't like the statewide approach to this. And we heard loud and clear that local officials, our state elected officials, preferred to have the option to make those decisions locally. So in hearing that and knowing that we have to do something else about our smoking rate. I mean, we are still 49 or 50th in smoking rate, right? We know we have to do something. The health outcomes speak for themselves. So what can we do? And as Bonnie said, it's the next logical step, but it's really our only next step. We are stifled in Kentucky with where we are on passing a statewide smoke-free law. It's even our health advocates can come together and say, you know, it's not the time. We won't gain ground on that, and we have to look at what we can do. And this is one of those ways that we can make a difference without forcing a mandate on communities, without costing the state any money, and with the hopes that this will really help decrease healthcare costs by, one, eliminating a new generation that could be addicted to tobacco products, by eliminating that sale and marketing to youth. So it helps us, but it's really our only next step if we're going to look at addressing health disparities.
And I think one of the reasons it's our only next step is because, you know, the legislature is going to have a tough session this coming year. Last year was the traditional budget session, 60 days long, and they usually pass a 2-year budget, but because of COVID, they only passed a 1-year budget. So this coming year, we're looking at a 30-day session, and they also have to pass a budget. And so, and we're expecting to have significantly reduced revenues. We'll wait and see what the next report says when it comes out in December. And so there's going to be less money to go around. So right now, focusing on asking for money and asking for statewide mandates is just not something that we think has a very good chance. But we think that this, as a, you know, in one sense, a red tape reduction law, because we're repealing a state law, and it's not a mandate for local communities, so we're not costing them anything, is an opportunity to pass something that could be really, really useful and effective, and allow those local communities to be the testing, you know, pots where you usually are. A lot of times your little local communities can try things that will work in their community and set an example for other communities in the state. So that's why another reason why we think this is the ideal time to be looking at repealing local control, prevention, or preemption in Kentucky.
And I would just add to that, Bonnie, Mahak, if I may, you bring up such a critical point in that what we're up against with the state legislature and the number of days, making this a priority is incredibly important. And then the second point being there isn't going to be an additional law written. This literally is just going to take a law off the books. So it doesn't add anything. It just removes, you know, a ceiling for communities to where they can act. So it's important to have these conversations, and I'm so grateful that we are with all of the people on the call, because making this a priority for this coming session is critical. And in the very few days that we have to make that case, it's just really important, and I'm thankful to have each of you on the call. So thanks.
Thanks, Shannon. And yeah, I think the point that I'm just hearing from you all, it's just feasible, and why not? Now is the time. So I appreciate that notion of calling that urgency out, especially in a time where we're going to have a short session. There's budget, there's so many priorities that we're trying to navigate as a state. So I think it's helpful to have all this background context that you all have provided. But as we speak about just the legislative session that's coming up, we know that, you know, it's a tobacco issue still at the end of the day, and there's always opposition when there's any tobacco issue. So how do our advocates on the call kind of handle that opposition, and what is the opposition? Shannon, do you want to kick us off?
Sure, and I'll say that's a great question, because you're exactly right. The good news about this repeal is that we are trying to offer local control. So it does not require a community to pass a law regarding a tobacco issue. It just gives the option to do so. Another thing I will say is, in speaking to legislators that we have over the last few months, we've had zero opposition, which has been great. So they're either neutral or supportive or conceptually supportive, waiting to see exactly what the language looks like. So legislators are by and large very supportive of Republican and Democrat leadership and not, in giving their community the ability to have control on this. And the tobacco industry, we've spoken with some legislators there too. I mean, I shouldn't say the tobacco industry, I should say tobacco growers in Kentucky. and Kentucky Tobacco, they're not terribly opposed to local control, even on a tobacco issue, because most of the tobacco grown in Kentucky is burley tobacco, and very little of that is sold in Kentucky, if almost none is sold in Kentucky. So those are issues that you can feel comfortable talking about. And then really just when you are speaking to your elected official, just letting them know that this is not a mandate and this doesn't take anything from the state. The state still has the ability to enact laws that would protect the health of the public, but it does not require the state to do anything or local communities to do anything. So those are some of the messaging tools that you can use in talking to them. So we've been very happy, though, that we haven't had opposition, even from some of the people that you might think historically have been opposed to tobacco issues, because we are really highlighting this as a good thing. This is allowing good things to happen. This isn't a fight. This isn't taking anything away. And it isn't targeting tobacco or people that smoke. This is truly looking at just additional measures to combat the health disparities across the state.
Yeah, Shannon has led a great team of people who are meeting with legislators, as many as we can. We've even already had a hearing on this topic during the interim, with the Interim Joint Committee on Local Government. And our two sponsors for the bill, who will introduce the bill in January, testified, as did the Kentucky Chamber. So the state's, the statewide business chamber is supportive of this. As well as a member of the Foundation for Healthy Kentucky staff, Allison Adams, who also, by the way, just completed a 4-year term as president of the Kentucky Health Department Association. And so we have seen good support for this, or neutrality among people who might otherwise be opposed, and we've already had a hearing. So when the bill gets introduced in January, we're hoping that it will move quickly through. Now, that said, absent opposition, you might think, well, then it's just going to pass. That's not the case. What we really need, starting in December after the election, is for constituents across the state to call their legislators and say, this is important, because this isn't necessarily going to rise to the level of a critical issue unless the local community, constituents and voters in the community let their legislators know it's important to them. So this is one of those issues where we really need people out in the state contacting their legislators starting in December and moving heavily into January and February, saying, please take a look at this. It's not a mandate. It's important for local communities to address the health issues and the cost that they're seeing from tobacco. Please allow local tobacco control. Really going to be important in order to get this on the agenda.
Thanks, Bonnie. So I have one last question. If partners want to be engaged in this issue, what's your call to action to them, and how can they support this effort? I know you kind of touched on it a little bit, Bonnie, but Ben, how would you, as a youth, want other youth to engage, or what are some suggestions that you have?
Well, it's like you just said. I would say the most important thing you can do is to make change, is to get your youth involved. When it comes to laws being passed for the betterment of youth, there's nothing better to convince legislators than the youth themselves showing up to support the cause. As the people these laws are affecting, it's incredibly important that we get out and show our support. As a youth, I know we can't vote to make change or donate large sums of money, but something we do have is time, and we can spend that time showing our support for such policy change. I encourage any youth interested in getting involved to reach out to their school's guidance counselor or KYA itself at the Kentucky Youth Advocates website. I guarantee that they'd love to have someone passionate about making much needed change in their own community.
Absolutely.
Yes, and we would love to have youth join. Feel free to reach out to us, any of us, and we would love to engage them, especially this legislative session and moving forward as well. Bonnie?
It's made all the difference in the last 3 years. I mean, we had students from all over the state who were at our rallies, who spoke to legislators, who were at news conferences, and who testified in legislative committees. And really, that's what turned legislators to support the different things that we did. Youth are incredibly important because that's where the problem starts. And that's why the tobacco industry is marketing to them, is because they know if we can hook them early when their brains are still developing, that we'll have customers for life. And so it's really important. And Ben has done an excellent job. I really want to do a shout out to Ben because he has been such an important youth voice in the work that we're doing. And we're beyond grateful.
We certainly are. Are there any other calls to action, Bonnie, Shannon, that you all have for folks to get involved in this effort?
So I would just reiterate Bonnie's points to Ben. You have done a great job. It's so wonderful to see young people get involved. My daughter spoke at one of our board meetings on the importance. It's to get the engagement from youth. And Ben, you said something, we don't have the ability to vote, but we have really the luxury of time. And I think it's incredibly important that that's not lost on us in this call or on any issue that we engage our youth on, because they are the future. It is the most important to get them involved. And if we can get youth engaged in caring the way Ben does here on this call and being so knowledgeable about this, that's how you make change. I mean, that's how you combat the health disparities. That's how you get at, I think, what we are all here collectively trying to do. So I am just so proud of KYA and how well you all do in engaging youth, and just wanted to say thank you for that. And really the call to action is that be engaged, get involved, whether you are a youth, constituent, business owner, whatever your position is, getting involved, being engaged, contacting your elected official, that's what makes the difference.
Yeah. Write a letter to the editor of your newspaper. Write an op-ed to your newspaper. Write a letter, an email, or pick up the phone and call your legislator. Call your local chamber president and say, please contact our legislator and let them know that this is important for our community. Call your local county judge executive or your magistrates or commissioners and say, please tell our state legislature that you need the ability to pass local laws, to have the tools in your toolbox to help address the health issues and the targeted marketing that's going on by the tobacco industry in our community. So there are lots of different individual tools. And for the background on this, if you need a reminder, you can go to smokefreetomorrow.org. It's all one word, smokefreetomorrow.org, and look at the priorities tab, and it'll have some background for you on this issue, on this local control. And you can find all talking points and background, and we'll have a social media toolkit up there soon. And so post about this on social media as well, especially after the election. So now's the time to get writing so that after the election, you can hit send.
Thanks, Bonnie. And then one last thing I'm just gonna ask is, there's usually a Smoke Free Tomorrow Coalition Day at the Capitol. And I know things are a little bit dicey with COVID still, but can you let our advocates know when that day is so they could mark it on their calendar?
It'll be virtual, and it is February 3rd. So we want everybody to be engaged on February 3rd. And if you're not signed up for the Smoke Free Tomorrow newsletter, please go to that website and sign up for it, smokefreetomorrow.org. Kentucky Youth Advocates is always really, really good about promoting that day as well. And what there'll be is some backgrounders, a little bit more detail, and then an opportunity for you to then that day, again, contact your legislator and let them know this is important to you, because if it's not important to you, it's not important to them. You've got to share with them that this is something you want to see them do. And that's why that's the only reason they're going to do it, because, if you look back quickly to 2019 or 2018, the coalition had about $100,000 to spend on advertising for the cigarette tax. The tobacco industry spent $500,000, and that's why it went from $1 to 50 cents. So we don't have the money. What we have is your voices, and we've got to activate those voices.
Thank you, Bonnie. Thank you, Shannon. And thank you, Ben, for spending your time with us today. It was great to hear about this topic and kind of gearing us up for the legislative session. And I will say that I know that the Smoke-Free Day is actually on the week of Children's Advocacy Day. So it's going to be one of the activities that our advocates that are joining here today, and then our Blueprint partners across the state can participate and join. So with that being said, again, thank you so much. I am going to turn it over to my colleague, Alicia Whatley, to kind of close us out.
Thanks, Mahak. So I also want to really just say thank you to our panelists today, to Bonnie and Shannon and Ben. You guys were so informative and helpful in understanding this new policy. And we also want to thank Aetna for their support for today's virtual forum. So I think today we really heard about a lot of the successes over the past 3 years regarding like tobacco control in Kentucky, and kind of how that's led us to where we are now with this new priority for the upcoming session. So the goal is really going to be to repeal that state preemption law, and it's going to give local communities a tool that they can use to reduce tobacco use in their local area. But it really doesn't mandate anything at the local level or at the state level. And we know that repealing this policy can help to not only reduce health disparities, but also improve health outcomes for all of Kentucky. And specifically, it's going to help reduce youth tobacco use rates, which is so important for our youth. And so we know that engaging youth voices is going to be really critical to the advocacy of this policy. And so we want to thank Ben and his peers who have already been very helpful in advocating for this, but also will continue to be engaged in these efforts. And with that, I have a few reminders about upcoming events with KYA. So as Mahak mentioned, we are doing Children's Advocacy Week this year because we know that the General Assembly is just around the corner. We want to go ahead and get everybody signed up for that. It's going to be the week of February 1st through 5th. So you will have an opportunity to sign up to engage there. And then we also would love to have your input in planning this event. So we will be circulating a survey that everyone can give their feedback to help us plan for that. In addition, next week we will have another virtual forum, which is going to be an opportunity for all of our advocates to learn about different types of human trafficking and then the impact of COVID-19 on those. Our panelists are going to be Dr. Jenny Sprang from the Center on Trauma and Children, Rebecca Sim, who is the Director of Immigration Legal Services at Catholic Charities of Louisville, and Maria Cassiano, who is the Program Director at Paquita Empowerment Initiative at Catholic Charities of Louisville. So that's next week's forum. And then in addition, as we heard at the beginning, if anybody would like to spend one more hour with us this week, tomorrow morning, we will be hosting in partnership with the Blueprint for Kentucky's Children, the Council on Agency Executives, COSER Charities, and the Face It Movement, the Kentucky Nonprofit Network, and the Center for Nonprofit Excellence, lots of partners there, a virtual forum with the U.S. Senate candidate Amy McGrath. So that's tomorrow morning at 9:30 a.m. So everyone will have a chance to join us there. And we're going to be exploring federal issues and solutions focused on kids, families, and strong communities. And as noted, we have invited Senate Majority Leader Mitch McConnell to also participate in a parallel forum, so more to come on that. And as always, we will be sending out a follow-up email that's going to include today's forum in a recorded form. We're also going to have all the resources that were shared today for you to look at, and then links to RSVP for all the upcoming events, tomorrow's forum, next week's forum, and Children's Advocacy Week. So with that, I want to say thank you everyone for joining us today, and we hope to see you tomorrow and next week.